Welcome back, everyone, to The Dose, presented by SCB TV, Channel 182. I'm here with the one and only Dr. Colin Steele. Now, we're putting the focus today on the silent killer, hypertension. Now, many in your profession know how serious this can be, but someone watching us right now may not be aware of the true dangers. Explain.
So, hypertension is, yes, known as the silent killer, and a lot of people actually just don't know that they have it. So, we really encourage people to come in and get screened because you will not know and may not have any symptoms. Some people come in when they have chest pain, shortness of breath, but what we want to do is actually prevent that from even happening. So if we catch it early, we can prevent a lot of really devastating effects like stroke, heart attacks, vision loss, peripheral vascular disease. There's a lot of things that actually are affected just by high blood pressure that people aren't aware of.
No. So, Dr. Steele, I know we say that hypertension is the silent killer, but we're very much aware of words like stroke and heart attack. And you're saying if these things go untreated, high blood pressure, it could possibly lead to it.
Yes, so over time, actually, blood pressure will actually cause damage in the vessels. So if not treated, you put yourself at a way higher risk to actually either have a bleed from too much pressure in the brain, or the plaque will build up and you can have a stroke from one of those pieces actually breaking off.
Wow, and that's very serious right there. Now, I know like so many of our disease states, we talk about guidelines, if you will, that are set. I know you and your medical colleagues here are very serious about meeting those guidelines. What are the guidelines for blood pressure? Where do you want it?
So our goal pretty much overall is less than 140 over 90. So there's actually different stages of hypertension. So there's pre-hypertension, which is actually considered 120 to 139 over 80 to 89. And then stage 1 is actually 130 to 149 above 90 to 99 diastolic. And then there's stage 2, which is above 160 over 100. So if we can catch people in the pre-hypertensive stage or even stage 1, we're preventing a lot of problems down the road.
Wow. Now, someone watching us right now may be saying, but if I go and Dr. Steele checks my blood pressure, they may already be in stage 2. And they're saying, but I don't want to be put yet on another medication. Explain how it doesn't always mean you have to go on medication. And if so, the options today are much more manageable than in the past.
Yeah, luckily we do have a lot of medications out there now and even combo meds. So we don't have to actually keep continuing to add an additional pill, which people don't like. But then we also counsel them on their diet, exercise, you know, watching their salt intake, being active. Weight loss can actually improve their blood pressure drastically.
I have to ask this now, there's so many disease states and sometimes certain groups are more prone to have it. Is there anyone that's more likely to have hypertension than other groups?
Actually, African Americans are at more risk, and we actually do have to sometimes treat a little bit differently with them. So there's your typical standard medicines that you may use for people that typically work, but African Americans we have to consider other medication treatments.
Wow, and I guess that's why it's so critical to get screened, because I don't want to miss the obvious, but when we say the silent killer, I could have blood pressure issues and not even realize it.
That's right. That's right. And actually 1 out of 3 people right now adults have blood pressure. 1 out of 6 don't even know it. So it's a big deal.
And of course, there's so many services offered by Eagles Landing Family Practice here. Maybe there's a young man, he's 43 years old. He hasn't had a physical or seen a physician or medical provider in nearly a decade. Make a case for him to come in and get screened, especially for blood pressure.
That's right. Anybody, honestly, over the age of 18, you absolutely should be screened for high blood pressure and come in for your physicals, because then we can potentially discover something way early on. And you want to go every year. It's really important. Things can change. You don't know it, but they can change. And then we're there to help you. We'll screen you. We'll treat you if need be. We also have diagnostics available if they need to, so such as an echocardiogram and a stress test. We can do all of that here and really tailor to their needs.
Dr. Steele, so many of us say, but I'm not in pain, right? So why do I have to go?
Yes. So, because we actually will treat you when you're sick. We love to treat you when you're sick, but we actually want to keep you from being sick.
That's right.
And so you don't want to, honestly, we want to see you when you're well yearly, so we can go over everything, make sure that we've answered all of your questions, and that you're aware of your potential health risks in the future. So just coming in for, maybe a sinus infection, we're not getting the whole picture for you. So we really want to treat the whole head to toe.
Stay with us on The Dose. We are serving up some information and much more. Now, be honest, Are you using that salt shaker more than you should? Well, I'm not going to be the one who tells you the truth about it, but the one and only Dr. Vera LaFosse with Eagles Landing Family Practice will be. Welcome. Thank you for joining us.
Thank you for having us.
Now, you know there's someone saying, okay, Dr. LaFosse, I'm putting a little bit of salt on my food. What's the big deal?
The big deal is you're at risk. You're putting yourself at risk for hypertension. You know, many people say, you know, I only just add a little bit, but over time that can actually make huge effects to your meal and to your overall health.
Absolutely.
In general. Yeah.
And so when we talk about the salt shaker, you shared with me previously that, wait a minute, it's not just the salt shaker or putting it inside of that shaker, it's the processed foods that we're eating as well?
Yeah, exactly. A lot of people say, you know, I don't add salt into my food.
Okay.
But they would eat something that maybe is processed either in the freezer, comes prepackaged, unfortunately microwave meals, things like that, canned foods, unfortunately, how do they preserve it? They put it on the shelf. How do we do that? With salt and preservatives. So it's important to realize maybe you may think you're eating healthy because you're not adding salt, but just kind of be mindful of those things that are processed in a bag, in a can, or in the microwave, in the freezer section at the grocery store.
I see. Now we're putting the focus on hypertension, blood pressure. So if someone didn't do that in the past, or it's family genetics to a certain degree, or they're aging, or they just have been diagnosed with hypertension or blood pressure, they come see you or one of your colleagues here at Eagles Landing Family Practice, right? Yeah. And they're saying, okay, you've been diagnosed with stage 1. What does that mean? And when is it time perhaps to look at some medical options?
So usually if your blood pressure, just to kind of keep it simple, if you notice your blood pressure is creeping up in the 140s or the 140s and above, over 90s, that's a time to be like, okay, now I need to definitely kind of seek some medical attention.
Yes.
Lifestyle changes like we discussed before, diet, if you are able to get a little bit of exercise in, that's very good. So when they come to see us, we'll discuss those things. If it's to the point where lifestyle changes can help us, but then we have other options such as medications, things like that. Now medications, that's one thing that you kind of have to, you know, find what works for you in particular. What are the kinds of medications we have? That would include medications to help you urinate. You would hear people call it a water pill. And then you have other medications that help your heart rate just get down just a little bit to help your heart not to have to work so hard. Then you have other medicines that work on your actual kidneys. So there's different kinds that can actually help you out, definitely. But you come on over and we'll help you kind of figure out what's what.
And I want to right now horn in on the true danger of hypertension, right? Because it's allowing the body, the heart if you will, to work a little harder than it's supposed to.
Yes, ma'am. And you know, we talked about it being a silent killer.
Yes.
So the fact that your heart is having to work harder, it leads you to things like stroke and heart attack. So it's very important to have your blood pressure controlled from all aspects. If it's lifestyle modifications, if it's medicine, if it's getting some exercise in, things like if you're a smoker, to decrease how much you're smoking, or to stop smoking altogether. You know, things like alcohol use, excessive alcohol use can actually increase your blood pressure too. So, you know, it's very important to kind of keep all those things in mind to really get a handle of getting the blood pressure down.
Certainly, which is so critical to our health.
Absolutely.
Love that. And we can make a difference in our own lives and be around for our kids and also our grandkids.
Absolutely.
What a joy speaking with you. Well, stay with us. You're watching The Dose.